Hello, everyone, and welcome to Your Health in Your Hands. My name is Dr. David Ajibade with the Brain and Body Foundation. I want to say again, thank you for staying with us and for being so engaged on the platforms in what we're doing. So, thank you so much. For this next series of episodes, we're going to be talking about neurological or brain disorders in children, and I think this is a topic that is very near and dear to me. I had no idea that there was such a problem in this country. A quick example, just a quick clue, is that up to 70% of births in this country are not being done in a hospital. You may ask, where are they being done? Well, in a hospital, not a hospital, in schools, in churches, in traditional birth attendant places, and at home, anywhere else than a hospital. And so, why is that a problem, you may ask? Well, it's not a problem if the delivery process is uneventful. The woman has a maybe 6-hour labor and boom, the child is out, and the grandmother or a skilled midwife is there to take care of the sanitation and the hygiene and take care of the baby. The problem arises when there are complications. Maybe the birth canal is too narrow, maybe there's an infection, maybe there's hypertension, maybe the woman is diabetic, she has a pre-existing condition. All these things can put that delivery process and that child at tremendous peril. And at our foundation, as some of you know who are familiar with our work, we see a lot of these conditions. Children who, for some reason, some of them I've mentioned already, stayed in the birth canal for way too long, and they didn't get enough oxygen, they didn't get enough nutrients, and it damaged their brains. So we have kids with cerebral palsy, and then you have kids with infections. Some kids actually have autistic-like symptoms. Some actually become dyslexic. Some actually develop seizures, just seizures. So we see a whole bunch of these conditions, like I mentioned. And again, that is as a result of events happening at or around the time of birth, the perinatal period, it's technically called. So we wanted to say, well, let's first of all educate Nigerians on these perils and these issues so that you don't take your pregnancy for granted. For instance, you want to go to a hospital, you want to ensure that you enroll in a prenatal class, antenatal classes, ensure that you ask all the questions, ensure you take the nutrients and supplements, ensure you're taking the right kind of food, ensure that you're not putting the wrong things in your body. There are some things that you think are okay, but they are not. Also, you want to be careful too about if you have a fever or a discharge during pregnancy. These may be subtle, but there are signs that something is going on. If anything affects you, it's certainly going to affect the baby. And there are crucial times during which the development of the brain, the whole 9 months are crucial, but the most crucial window period for when the brain needs maximum development are usually that first trimester. And so anything going wrong around that time, maybe you don't have enough folic acid, maybe you don't have enough vitamin D3, or you don't have enough omegas, or you have an infection, or you're working in a lab where you're exposed to chemicals, you're inhaling chemicals on a daily basis. All these things can affect your baby in a way that you cannot begin to imagine now. So I just wanted to mention at this start of this program that your pregnancy period is crucial. You need to get all the information, and this is not just for the mothers alone. This is also for the fathers. You have to play an active role in this. Study, research, ask your doctors questions, your nurses questions, ask your relatives. What do they do right? What should they not have done? What mistakes did they make in the past? Because again, all this affects the health, especially the brain health of your child. And once these things set in, it's very, very, very difficult to get to treat. Remember, the brain is the most complicated organ in the entire known universe. There is nothing more sophisticated or complex than it is. A slightest tiny cubic meter of brain cells The complexity is just boggles the mind. So to treat and to address brain conditions is a big deal. So let's in this series, in this segment here, we're going to just do an overview, and we're going to talk about some of the things that we've found out that have been helpful, so that even if you're in that condition, even if you have a child that you are dealing with that has these issues, I want to say that hope is not lost. That there are, with new research, with new brain imaging technologies, with new diagnostic tools, and even with new therapeutic tools, we now know that we can effect certain levels of recovery. And that's exciting for me because I've always been interested in the brain and how the brain works. And so we were trained in medical school that, when the brain is damaged or you've lost brain cells, that's impossible. It's impossible for you to regain those brain cells. And I know some neurologists still hold on to that fact. Well, the truth is now we know that the brain can actually reproduce new brain cells even after they've been lost. And there are certain centers in the brain that can do just that. And I think that's really exciting. Like I said, your brain is actually producing new cells every single day, even at an older age. But the cool thing is that with children, the reserves are so much greater. So if we can catch them at an early stage, there's a lot that can be done. So I want you to stay tuned, and we will get right into it when we come back after the break.